and Labor Day approaching us, it's important that we hear from our local officials and leaders and public health experts on the outlook of our community. Our judge and mayor will speak about what to expect as we work toward getting through this pandemic together. And Dr. John McNeill and David Gonzales will speak about the outlook of COVID-19 in our community. Finally, we'll hear from Dr. Quintin Shepard, VISD Superintendent, about virtual-only classes which begin tomorrow. Questions will be taken by our public health experts, followed by Dr. Shepard. One update, in the meantime, I'd like to relay is on behalf of our compliance task force, who have been proactively going out into the community and educating local businesses, which includes restaurants, about the 50% occupancy limit. The task force has actively been inspecting all local restaurants and businesses, including following up on complaints received. At this time, no violations of this rule have been discovered. Everyone has been compliant in maintaining proper social distancing and the wearing of masks inside the facility. The task force continues to monitor and help educate businesses during this time. We thank them for the work that they're doing to help educate our businesses. Before we hear from our speakers, I'd like to provide you with today's information about the status of COVID-19 in our community. Today, we have new cases is between Sunday, which was not released to the public, and today, which is 18. Total cases in Victoria County is 3,629, which is approximately 4% of our population. Recovered is 2,228. And active right now in the community who have COVID-19 is 939. Hospitalized is 51, and recovering at home is 888. Remember that these counts will be updated at the end of each day. To put this data into perspective, we've been updating these counts on a daily basis in an infographic for you to refer to that data and make informed decisions based on that information, which includes the information I just relayed to you today. At this time, we will hear first from our Victoria County Judge, Ben Zeller.
Thanks, Ashley. Good afternoon, ladies and gentlemen. Thank you for tuning in. Although it's been a few weeks since our last press briefing, I wanted to take the opportunity and let the public know that our local leadership continues to diligently work together to respond to the COVID-19 situation in Victoria. From our very first press briefing back in February or March to now, our goal has been to provide the public with the most accurate information, to work to limit the impacts of COVID in Victoria, and to respond to the effects in our community that do occur. We've done that by working closely together with all of our entities, city, county, school district, public health, our hospitals, as well as emergency management. I know that everyone is tired of COVID affecting their lives and routines, and everyone is tired of even hearing about COVID. I can tell you also that nobody would like to put this behind us more than Dr. McNeill and our public health folks who are on the front lines every day. But as long as COVID remains prevalent in our community and a danger, you can count on us to continue to do our jobs of relaying accurate information, of protecting the public health, and of doing the things that you deserve from your elected officials. Fortunately, in Victoria, we have some things that other communities don't have. An outstanding local public health authority, as well as an outstanding local public health department, and a very coordinated and effective team approach to dealing with COVID. As a policy team, we get multiple updates daily and meet together in person on a regular basis to look at the most recent data that includes hospital-related data. We'll continue to do that, continue to update the community, continue to face our challenges head-on while relaying the most relevant and accurate information that we have. And I just really want to take the opportunity to say thank you to our community, to our residents who are working with us to help make this effort a success. So thank you to them, and turn things now over to Mayor McCoy.
Thank you, Judge. As the judge mentioned, we have a tremendous group of people working on this situation with COVID, really on a daily basis. It's a group working to problem solve, and that's what we've done throughout this pandemic, and will continue to do so. And we do it on a weekly basis, formally, and on a daily basis at any rate. And what I would like for everybody to understand, that even though numbers are going down from what they were in the midsummer, now is not the time to get complacent. When you think back when this pandemic first began, we kind of got a heads up that cases were coming from what was happening in other parts of the country and the state, quite frankly, and we prepared for it, and we actually shut down to a great extent. We had stay-at-home orders. We had businesses that weren't allowed to operate and everything, and the numbers really had a cap to them. We put a lid on it pretty effectively. And then you'll recall around in May when we started seeing those numbers go down and not really grow, that we opened up again and began opening up our businesses, and many of the things that were shut down. Stay-at-home orders were rescinded. And then along comes Memorial Day, and everybody getting graduation celebrations, family get-togethers, and then couple that with July 4th right behind it, and then we saw this eruption, this massive eruption of cases that came upon us. And thank goodness that those numbers are coming down, but we've had to do things like the governor's going back a little bit, cutting back on some of the openings, shutting down some of the most prolific of the businesses that were contributing to the rise, and most importantly, the wearing of masks. And it seems like a simple thing. A lot of people will argue it one way or the other, but I think we're seeing the numbers coming down as a result of it, quite frankly, because unless we're washing our hands a heck of a lot more frequently and staying away from each other more dutifully, then the mask appears to be working. So I would only caution, let's not get complacent again, because here we come with Labor Day right around the corner, the opening of schools face-to-face. So now is the time to remain very vigilant in our activities to curb this the spread of this disease. And it's the same thing. We heard it from the governor last week. Wear your mask, social distance, and practice hygiene. And those are the most effective things that we have until an effective vaccine comes for us to fight this disease. The other thing we have to be cautious about is there's predictions for a more highly active flu season, and that on top of COVID is not a good combination. So you're going to start seeing probably public announcements to get your flu shots, and we need to get busy and start immunizing ourselves against the flu, because the last thing that these folks that have been fighting COVID every day in those emergency rooms need is an influx of flu on top of it. So that's what I would caution everybody and ask everybody to do as we move forward. Thank you.
Thank you, Judge and Mayor. Shortly, we'll hear more from public health experts. And so at this time, I'd like to thank our elected officials for all the work that they do for our community. And behind the scenes, I see it daily, weekly. And so we just thank you for the hard work that you do to combat COVID in our community.
Thank you, actually.
Thank you. Judge and Mayor will be available following today's briefing if you have any questions. In the meantime, we will welcome our Public Health Director, David Gonzales, and Public Health Authority, Dr. John McNeill, into the room. I want to reiterate and echo what Judge and Mayor just said, and that's to be smart. Don't be afraid, but be smart about this disease. You know, there's not a vaccine yet. We've talked about all the different orders that have been put in place, the state orders, so just be mindful of those around you and make sure to follow the state orders and the CDC guidelines, which recommends facial coverings and covering your cough or sneeze with a tissue. At this time, I will turn it over to David Gonzales.
Great, thank you, Ashley. Just wanted to give a quick overview of kind of looking back a little bit in the last 5 months of COVID, what we've seen here from a public health perspective, and kind of looking ahead, what we want to really be cautious of and the actions we want to take moving forward. As we look back to the response back in March and April, we were definitely very cautious. There's a lot of unknowns with the virus, so that was really what was basing a lot of our response and our activities and things that we had directed to do. Right now, moving in through May, June, July, we saw a rapid increase after the kind of the Memorial Day holiday. We had some activities associated with that weekend in early June. We had a lot of graduations. We had some holidays mixed in, a lot of social gatherings as well. Looking back at the data, we finally had time to compile some of the average ages that we saw in a lot of our active cases. And what we were finding is we were seeing a lot of the younger population, 20s and 30-year-olds, really be a majority of the cases during that time. As we moved through the months after that, we saw the cases, the average age case increase significantly. Up until this point, we're about 49 years of age as of today. So what that tells us really is how the virus and activities really dictate how the virus moves through the community. We had some outbreaks, not really outbreaks, clusters associated with some public gatherings and social settings. So that really dictated how the virus kind of moved through the community as a whole. One thing that's important to remember is not all the cases are acquired in social settings or outside. A lot of household contacts we found. We saw transmission in those settings. You run into cases with multi-generational households that would transmit the virus in those settings as well. Right now, luckily, we've seen a dramatic decrease in cases here as of late in the past few weeks. Most of that due to folks taking those precautions and using facial coverings and avoiding those social settings where you have a lot of social gatherings or large social gatherings, as well as the other hygiene precautions we have talked about previously. Looking ahead, one thing we want to make sure is we don't fall back into the same situation we were before, where we let our guard down as a community moving forward. Keep doing what we've been doing to keep those numbers down low. One thing we're going to look at doing that we have coming up, and Dr. Shepard will touch more on this here shortly, is we have schools opening up, obviously, pretty soon and as we speak. So we'll be coordinating that as a health department, coordinating closely with those schools to monitor any cases, give guidance, and coordinate with any outbreaks or influxes in cases there in those settings. A few more things. We've had some questions regarding testing here locally. We had some concerns about our low case counts possibly due to a low number of tests available. We're not aware of any testing shortfalls. As far as the information we have, there's plenty of testing available for those folks that do need it. So please, if you are symptomatic, you need a test, seek that out. But right now, I think really the overall case count reduction is truly due to the lower case occurrence in our community. Lastly, I want to touch on a few things. Right now, we have our, Ashley stated what our active case counts were. We'll be working this week to coordinate with the state data that we have. The Department of State Health Services has taken over a large portion of our investigations. We'll be merging that data and hopefully reducing that active case count down this week. One last thing, we have temporarily suspended reporting on Sundays. We've had low case counts come through the past month or so on Sundays, so we will be reporting those numbers on Monday going forward from here on out, for the time being, excuse me. With that, that's all I had, Ashley.
Thank you. So just to reiterate a couple main points there, Sunday's data will be reported on Monday's case counts, so be on the lookout for that. The Health Department is working on merging data with DSHS this week. And then the other 2 points that I wanted to make is that there are no testing issues in Victoria County, so we have plenty if they are needed. And then the last was to be mindful of those living in your household. Whether you think you could carry the case or not, be careful of those that are maybe older or have underlying health conditions, especially if you're living in multi-generational households. And Dr. McNeill will touch a little bit more on that, I'm sure, in just a second. So Dr. McNeill, turn it over to you.
Thank you, Ashley, and good afternoon. I just have a couple little things just a few little things I want to discuss, and, I have some concerns. We seem to be doing better. Our numbers have gone down. I remember in the beginning when we had 3 or 4 cases, and we really thought that was a dramatic, terrible thing, but pretty much one day of 222 cases pretty much changed all that. So we've still been seeing some pretty, small numbers, but as compared to those numbers, but really when you look at it, there's still, the cases still continue because the virus is still out there. I will compliment and commend the people of Victoria. I mean, everywhere I go, I see masks. That's wonderful. There's just no way to put a number on how many cases that this is going to slow down. You have to remember that you stop the transmission of one case, you may stop the transmission of several hundred cases within a week or two. So this is exponential growth. So anything we can do will help. One of the things that does concern me is, first off, like David said, we don't want everybody to get a false sense of security here just because these numbers are down. Well, it's 100 degrees outside, and we're in the middle of summer, or hopefully toward the end of summer, and we are not in flu season. We're not in cold and flu season. We're not in upper respiratory infection season. That's coming, and that's what I'm worried about. I'm worried about the perfect storm here, folks. I really am. And I'm worried about that because when you think about it, I mean, our kids are going back to school, and regardless of what you may believe about that and what your personal thoughts are about that, however you're going to do school, there's still going to be an increased number of cases transmitted because kids do transmit the disease. And like Ashley said a few minutes ago, a lot of our families in Victoria live in multi-generational homes, and there are elderly people living at home or in close proximity to these children. And I say children, I say 1st, 2nd, 3rd, and 4th graders can still carry it. But remember, at age 10, typically over 4th grade, the studies have shown that people age 10 and greater transmit the virus at the same rate as an adult. So we still have to be very mindful of that. And talking about that perfect storm, we're talking about more COVID being in the community. We're talking about kids going back to school. We're talking about more sporting events, more seasonal, events where people are going to be out around each other. So we're going to have to keep our guard up. The last thing is specifically upper respiratory infection season coming. I can tell you that every year, about this time of year, our hospitals, I'm not going to use the word slow, but our hospitals are certainly not as inundated with upper respiratory diseases as they are now. And that's because of COVID. We still have a lot of people in the hospital with COVID, and there are a lot of people that are doing poorly that are in the hospital right now. There are people in the hospital fighting for their lives right now from this illness. So I see those patients, and I know what they're going through. So I'm telling you that this disease is still out there, but what scares me is that if we put all that together, there's a new term that I heard. I thought it was just a joke at first, but then after I heard it on about the news for about the 4th time, and that term is twindemic. They're talking about a pandemic that could be with flu and a pandemic with COVID. A twindemic, of all things. We're not getting used to. We're just really trying to deal with one pandemic, and we don't need another one. So the Centers for Disease Control has been, and Dr. Redfield has come out and flat said that this could be one of the nastiest or worst flu seasons that we've ever had when you consider the fact that COVID is there as well. If you think about these two diseases together, I mean, think about it in this term. Say you're fighting someone or something. Fighting one person is one thing. Fighting 2 people is another. So just remember that if you get the flu, it lowers your resistance, and you can develop COVID as well, and you can catch COVID. You can basically acquire that disease just like you would any other way, except your resistance is going to be lower. You're not going to be able to fight it off. The disease is going to be stronger, and it's going to hurt you more, basically. So getting the flu can be terrible. It can cost you your life. Getting COVID can be terrible. It can cost you your life. Getting them both together can be disastrous. So let's always remember that. Now, what can we do about that? What can we do about that? Well, the Centers for Disease Control has really pushed it as far as vaccinations. We don't have a COVID vaccination yet. But right now, I can tell you, I just looked it up before I came in here, there's over 170 research teams right now that are going through the research to develop a vaccine for COVID. There are 7 vaccines that are in phase 3 trials. Phase 3 trials means that somebody is given the vaccine and somebody is given a placebo, and we compare the two to see how the people do. The only thing about that is that it takes time. And the longer it takes, the more accurate that vaccine is going to be, and the more successful it'll be if it's released. So we watch this very closely, but there is a vaccine out there, hopefully coming, and hopefully coming by the end of this year. That's their goal. So, that being said, we already have a vaccine for the flu, okay? But sadly, only about 45% of America gets it every year, 45%. So over half of our nation is not protected against the flu. Now, what we're talking about now, and what the Centers for Disease Control says, is 45 to 50% now. The goal is to get it up to 65%. And that number translates into some number that they've calculated that will tell us that that will be that number of fewer beds that will be utilized by flu patients that we can use for COVID patients. These hospitals were pretty full a couple of weeks ago. Our ICUs were full. We had people sitting in the emergency department because we didn't have any critical care areas for them to go. There were people up there, and it's a shame, but people were dying up there, and they're still dying up there. And remember, these patients that are in the hospital, a lot of them, I just got off the phone with one of the director of the hospital, it's Dr. Kano, from Citizens, and I'm telling you that we have patients that have been there 30, 40, even 50 days. So this is not a quick deal where you get sick, you go to the ICU, you get well, and you go home. These patients are there for a long time, and that takes a lot of resources. So we need to mitigate that the best way we can. The best way that we can is to keep people with the flu from occupying those beds. And the way we do that is we get people vaccinated. There is no reason, unless you have an allergy or some kind of hypersensitivity or some other rare reason, that you can't get a flu shot. Everybody should get a flu shot. And we're trying to make that more available. We're doing a lot of things to make sure that flu shots are more available this year. One of the things we're doing, we're working on a program right now with Victoria Fire Department, and we're purchasing a bunch of flu shots, and we're going to give them to homeless people, and we're going to give them to people that can't afford shots. The federal government typically purchases about 500,000 flu shots and makes them available through different programs for people that can't afford to get a shot. This year, they're purchasing 9.8 million vaccinations. So I'm telling you that everybody knows, and all the research, there is no arguing this. Flu shots work, and flu shots do not give you the flu, okay? You're not going to get the flu from a flu shot. And it doesn't, I don't go very long without somebody telling me that they got the flu the last time they got a flu shot. Well, they didn't get the flu. They probably got a little viral feeling that they got that meant only one thing. It meant that the flu shot was in your body and it's doing its job because your body is building a resistance to it. The other thing that you have to remember is that even if you do get the flu, now can you get the flu if you get a flu shot? Absolutely. Will it be as bad? No. Are you likely to ever end up in the hospital with flu after you've gotten a flu shot? Not very likely at all. So there we go back to our bed number. This is about bed numbers, folks. We're talking about being able to have the resources to take care of people and save their lives. If we can prevent some of this, then we will. And we can prevent that with getting a flu shot. So go get a flu shot. $25 usually what they charge if you don't have insurance. You can get it through your insurance. Yeah, you know, you can't go into a pharmacy right now without somebody wanting to stick something in your arm. So you can get your shots at the pharmacy. You can get them through your doctor. You'll get them through the health department. I think David's going to be giving them. I'm not sure, but they are out there. Okay. So the other thing I want to say is that remember, we're always talking about the 3 W's. You know, I can't come up here without saying wash your hands, wear a mask, and watch your surroundings. Okay, the 3 W's. That has already shown to work. All right. We have no COVID vaccine. We do have a flu vaccine that we can use, and we have our ability to wash our hands, to watch our surroundings, and wear a mask. Okay. I think those are the biggest points I wanted to bring up, and I guess we'll take questions.
Sure. Open for questions.
Do you think that parents should prepare their students for the idea that they're likely going to be wearing masks all year, all school year?
I personally think so. I mean, I don't think that COVID's going away anytime soon. I mean, this idea of herd immunity, you know, people keep talking about we need herd immunity. Well, we're probably at 3 or 4% right now, and you need about 65 or 70. So I'd say we still have a long way to go before that's going to happen. And this virus isn't going to just go away until it's infected every person that it can.
Just a conversation to have with their students.
I think it's a great idea. I mean, I think it's probably very timely, and it's part of our age. I mean, you know, even my children. I mean, my 3-year-old came up to me the other day when I was one of the times I was quarantined. And anyway, she came up to me and put a mask over her face and said, "Can I hug you now, Daddy?" So, yeah, so I would answer that, yeah, that's a good idea to have that conversation.
Dr. McNeill, could we talk a bit about what happens if there is an outbreak in a school this year? I mean, do you feel at all that your authority has been hamstrung as local health authority? Because, you know, if we were at a high level of community spread on September 7th,
Yep.
My understanding is that schools would have to open and they couldn't close until there was a case in a school.
Well, you know, there's a lot of data out there, and we were just discussing that very case. Dave and I were discussing that because we want to make the right decisions. And, you know, this whole business about the authority of the local health authority, that kind of depends on which day you're asked and which state official you ask. And I think they've done a lot better. They're on the same page now, as far as I know. So for the most part, they've never taken the ability away from me to close something down if I think that it's just downright dangerous. And if the schools become what we term as just downright dangerous, then yes, we will shut them down. But we've come up with a plan. I mean, we've come up with numbers, and you know, Dr. Shepard's going to talk to you about this, and I was just joking with him a few minutes ago. They've come up with a program that we're putting a lot of different data points into. I mean, we look at the positivity rate, we look at the number of cases, we actually look at the hospital situations. I mean, it's one thing if you have 100 people sick in the community and no hospital beds, as compared to 100 people sick but plenty of hospital beds. So there's a lot of different things, and there's actually a program that he's came up with, and we actually are going to look at those numbers, and it's going to be watched very closely. But it's something that we do take very seriously, and it's not a decision that we would go into lightly. But it's something that if it needs to be done, it will be done.
To that same point, what about, I guess, whose responsibility is it to shut down a restaurant or a bar that's become a restaurant, or a bar-restaurant hybrid when they're clearly beyond those capacity limits? We've just gotten so many comments and calls from viewers worried, about businesses like 5D and Froggies, and you can see they're double parked. Who's supposed to be responsible for enforcing that?
Well, those actually, I can tell you that there are people from the health department, including myself, that watch that, okay? And there's actually a law enforcement. I mean, we look at the occupancy numbers, and that is actually done by the fire department. And I've had that very conversation with you because I've driven by and seen establishments where they're parked down the street behind there, and I'm thinking, now that can't be right. But we've done inspections, and we've actually gone in there. I haven't. I don't go in there and count people. But the fire department does. And they've gone in there, and the fire marshal's office has gone in there and called me back a few minutes later and said, this is what it is, this is what it does, they're doing a good job, they're actually legal. So while it seems like that, now you would think that every one of those cars would have a few people in it. But I can tell you that we have gone so far as to count the cars and count the number of people. And you would be amazed at the number of people take their own car to a bar. I was amazed when I found it. So if I can reassure anything, I can tell you that is being watched. Because, our job in public health, and David and I have talked about this a lot, our job is to make sure if there's anything we can mitigate to make the public healthier. And a bunch of people all crowded together and disregarding our orders or our recommendations, that's a problem. And we do address it. So that's actually interesting because the same thing you asked is probably the same question that I asked the fire marshal's office.
Did he give you a specific number of citations that they've issued, if any?
I think they've
Catalina,
issued some, yeah, go ahead.
I was going to say, I'll answer that one, because I actually did speak with our fire chief this morning, and so he is in charge of that task force that Dr. McNeill and David are referring to. And this morning, there had been no citations, so they have been actively going in and responding to those complaints. And so kind of like what Dr. McNeill was saying is looks can be deceiving. When you go in there and look at the 50% occupancy limit, they are following those rules. When you look at social distancing and making sure tables are separated, they are following those rules, and of course wearing facial coverings. And so that's the latest as of today. But they are actively going to continue monitoring that in the community, and so if there are complaints, they'll definitely respond to those as well. Any other questions?
I do have one more question.
Sure.
I just wanted to make sure that I ask it correctly. But do you think that the younger community, like these students that are about in middle school, in grade school, will we see an influx in COVID within their age group with school starting?
Well, I can't predict what's going to happen in Victoria, but I can tell you that it's happening everywhere else.
Okay.
So,
Thank you.
Any other last question?
Quickly, what is our current level of community spread? Where do we consider it? And then does the health department's involvement change at all when you're investigating a case in a school as opposed to any other case that's being investigated?
So currently, I mean, we're still, I guess in our view, still a significant community transmission, even though the numbers have dropped. I'd be kind of leery to drop that to another level down, one level at this point. Still, I think this may be a temporary lull, like Dr. McNeill touched on. It's happened in communities around us where schools have opened up, so we're just kind of, I guess, we're waiting for that and preparing for that. As far as cases investigated with the schools, we'll handle them like we do any other case. We'll investigate the case, we'll investigate those high-risk exposures and close contacts, but the additional piece with that is going to be working with that school staff and VISD administration as well to monitor the overall situation in those settings, working with the school nurses and those folks there to make sure we mitigate as quickly as possible future spread.
Thank you for your questions today, and thank you for your time, Dr. McNeill and David. At this time, they will leave the room and allow Dr. Shepard to come in and speak to you about VISD updates. In the meantime, I want to reiterate some of the main points that Dr. McNeill and David wanted to relay to you, the public. COVID and flu season is approaching us, and so of course that will place an even stronger impact on our hospital capacity and their resources. And so Dr. McNeill is charging you all to get your flu vaccination. There are free testing or free vaccinations coming, and more information is forthcoming on that. In the meantime, you can look for flu vaccination at your local physician's office. Walgreens is another example, and that should be available. At this time, Dr. Quintin Shepard will speak about VISD Superintendent.
Good afternoon. I've got a few pages of information that I want to share with everyone today, so I'll get through that and then, of course, take any questions that you might have. Just to start with where we are as a district. Presently, we have 28 staff who are currently quarantined. In total, since this has started, we've had to quarantine 130 staff members. What that means for the district is that we've had 604 days that were work days that were lost. Now, many of these employees were able to work remotely, but certainly not all. Total number of positive cases that we've experienced in the district is 30. Total number of positive cases that we're on top of now, 5. I'm going to talk a little bit about education first and where we are instructionally as we plan for the start of school tomorrow, remote start. I'm happy to say that we have 98% of our population has gone through the registration process. That's great. We now kind of have a good sense of how many kids to expect. However, the part that is still causing some questions for us are that of that 98% who've registered, approximately 20% of those parents, so between 2,500 to almost 3,000, have not told us whether or not their students need devices to support learning, technology, or hotspots. They haven't told us whether we should prepare for their students to be back in person or if they're going to continue to be remote as we get started into the school year on September 8th. So a big part of the reason why I'm here today is a plea to those parents who have not filled out that survey to please let us know what supports we can provide you so that your student can continue to learn. That's really important for us. And of course, I want to thank the 80% of the parents who have filled out that survey and have allowed us to plan to the best of our ability in preparation for the start of school tomorrow. I'm going to talk a little bit about professional development and curriculum. So our curriculum instruction and accountability teams have worked over the last several months developing plans to support both face-to-face and remote learning in what we're calling synchronous and asynchronous learning formats. We're using the language of the state in order to keep everybody on the same page. From the beginning of July to today, we've offered over 247 courses for our teachers with over 6,400 attendees, and trying to help our teachers become more proficient at remote instruction and in developing digital lessons. Some of these training opportunities include the use of Microsoft Teams, online textbook resources, study sync, software programs, designing virtual lessons, on and on and on. The power of podcasting and other technology support programs in order to provide high-quality instruction for our students. The content and delivery of the instruction through these designated formats will hold a much higher level of rigor and expectations for our students going into this fall. It should be a dramatically different experience for our kids when they come back. We're much better prepared. Students will have the opportunity to interact with their teachers through live instruction as well as through remote learning opportunities using the Teams platforms. Students who are remote will have the opportunity to listen to live instruction from home, or they will have their access to their materials asynchronously so that they can continue their learning plan. VISD curriculum teams have been working with content experts and campus-based instructional coaches within the district to analyze any unfinished learning that may have occurred in the spring, and they've devised supports for those students as they come back to school now this fall. VISD will continue to support our special populations, which of course includes our gifted learners, our special education students, dyslexia students, 504, and limited English learners, with those staff who are expert in those content areas. In addition to the academic teaching and curriculum supports, the curriculum department has invested time and support in identifying a curriculum for social emotional learning and has trained all of our counselors and social emotional behavior specialists on campuses in the use of this curriculum to support our students. Training for understanding the social and emotional supports, particularly during the midst of a pandemic, is critical to building relationships with our students. And we're happy to be able to provide these supports for our students moving into this year. Let me talk specifically about elementary for just a few minutes, and then I'll move on to middle school, and then I'll move on to high school. So at elementary, we've secured multiple high-quality instructional resources that will be used to provide instruction to the elementary students in both remote learning and face-to-face learning environments. We're working to implement the online components of our textbook adoptions, and students will have access to new learning tools in all content areas. Over the course of the next several weeks, students will be introduced and begin using these new resources. Remote instruction is set to begin for all registered elementary students at 8 a.m. tomorrow morning. Instruction will be delivered through a combination of synchronous and asynchronous lessons. This means that children will have the opportunities to participate in live sessions with their teachers and their entire class, and in small group sessions as well. If you have completed the registration process and have not been contacted by your child's campus or teacher with specific instructions for logging in, please call the campus office so they can get that information to you. If you have difficulty logging into class for the first day, please email your child's teacher so that they can contact you. This is the fastest way to get you plugged in for the education that needs to happen. We are anticipating a high volume of phone calls tomorrow. If you're not able to reach the campus by phone, email will be the best way to contact campus staff directly. On Tuesday, September 8th, students who've selected face-to-face instruction will be welcomed back to campus. The face-to-face and remote teachers will follow the same scope and sequence and use many of the same instructional resources to ensure that all students have access to the same content and the learning is equitable for all students. Parents who are interested in changing their initial preference, those who've chosen face-to-face, for instance, need to let the teacher or the school office know prior to August 25th. So if you've chosen one mode of learning and you want to switch, please let us know and we'll accommodate to the best of our ability. On September 8th, in an effort to meet the needs of all students, VISD will begin full-day instruction Monday through Friday. Many students and families that have opted for remote instruction this year, and we're working to meet the academic needs of our remote learning students as well. So in short, we're trying to meet the needs of all students, remote and face-to-face when that time comes. And the reality is COVID-19 is not going to prevent us from serving the students. Because they're our priority. Let me talk about middle school and high school very briefly. So middle school campuses will begin their school year in a remote instruction as well. That also begins tomorrow morning. And during remote instruction, those students are expected to log on by 8:30 tomorrow morning. That's 8:30 tomorrow morning for middle school students. For high school students, it's the same story. They're also expected to log in tomorrow remotely, and they are expected to log in at 7:30 in the morning to begin their day. All of those schedules have been posted online, and you can find them on our website. For both middle and high school, we'll be utilizing, again, both synchronous and asynchronous instruction to support the needs of all of our students. Teachers will be presenting live interactive discussion where students can engage in instructional learning with the entire class and in small group instruction as well. Student lessons and assignments will be placed into the Microsoft Teams where all students will have access to their work. If your student is having difficulty logging into Microsoft Teams, again, I'll remind you, please contact the campus and make them aware of any and all technology issues. We know that glitches will likely occur, and we are anticipating that our entire student body will be logging in all at once through the next 3 weeks. So I'll ask you to bear with us as we work through this together. And that'll bring me to my final closing comments. This morning, we had convocation for VISD. We brought everyone back to kick off the school year at 9 o'clock, and we had a guest speaker, Dr. Cruz, who talked to us about the importance of being what he called merchants of hope. Merchants of hope. And I really liked what he had to say to our staff and to our school community. Here's the thing that I took away from him, what it meant for me. This pandemic is stressing all of us, superintendents, building administrators, teachers, students, parents, and community. This pandemic is stressing all of us in ways we never thought possible. It's requiring more from us than maybe we have to give. But I do have confidence. I do have confidence that we've done the work we needed to do over the summer to have a good start with our kiddos and with our teachers. I have confidence, you see, and this gives me optimism. And that makes me a merchant of hope, as we heard in our convocation today. And I'm asking you to be a merchant of hope with me, that we can and will get through this together. So to the parents directly, being confident and optimistic makes me think of what I said to staff last week, and I'll restate it here for parents because it's important. It's important to take this just one step at a time and just one day at a time. It's a long journey in front of us, and we're stronger if we're working in partnership together. Please don't hesitate to reach out to your child's teacher or the campus with any questions or concerns that you might have. We are in this together. And to the students, of course, thank you. I continue to say thank you every time I get a chance to talk to the students, because there are hundreds of students who participated in an online virtual town hall that we had, and because of the input and feedback that those students gave me directly about our plan, we've modified our plan to try to meet those needs. I thank the students because we've incorporated so many of their suggestions. I thank you, students, in advance for your continued flexibility. I thank you for your unending patience through this pandemic, and as we, the adults, try to support you in the very best ways that we know how. It truly is my great honor to serve as your superintendent. Thank you.
Thank you, Dr. Shepard, for that optimistic closing statement. Appreciate it. Open it up for questions.
Dr. Shepard, what happens when a student or staff member tests positive for COVID-19 within VISD? And does the district have any capacity to provide testing to anyone who might be exposed within the classroom?
So the question is, does the district have any capacity to provide testing? No, we're not currently doing testing for our staff or students. And the second question was, what happens when a student contracts COVID? So the first place I want to tell parents, because I'm going to give the short answer, but the longer answer, the more detailed answer, please go to our website, covid.visd.net. And you're going to find this is a brand new webpage. We just released this on Friday of this last week. And so instead of just one very, very long document where you have to scroll through 30 or 40 pages of material to find the answers to your questions, we've got very specific parts of this that have been tabbed on our website. So if you want to look at the elementary plan or the high school plan or the safety plan, for instance, you can find all of that information, as well as updates that we're planning to give on a regular basis. The question about what we're going to do when a student tests positive, we've got a number of protocols in place, including looking at the space itself where the student was and any of the contacts that that student might have made that would facilitate the quarantine period for our students as well, and potentially staff. And we've put together, and I want to answer the question you didn't ask, but I think that's equally important, which is we've put together a really, really good plan, and we're about to enact that plan. And for anybody that that would recognize the difficulty in enacting this plan is that there's going to be a certain degree of logistical chaos that comes along with it. Essentially, when COVID enters our buildings, and it will, in the form of both students and staff, that we recognize our plan is going to have to continue to change, potentially on a day-by-day basis. And as we just heard from both of the health experts, we know that this is going to happen. What I'll ask from everyone is continued flexibility and understanding.
I have a question about, last week, the chief of the Emergency Management Division for the state said that if you are missing or if there have been PPE delays for the school districts, you can go ahead and buy those and then expense them to the state and federal government. Well, what about parents? Can parents get those costs expensed if they don't have enough masks for multi-generational families?
Great question. I'm not aware that parents have the ability to expense those costs. Certainly, that's not something that I've been aware of. There's more that.
Is there still a delay in computers expected for mid-October?
Thank you. There is. We're expecting 2,800 computers still to be delivered that we don't have. We have 160-ish thousand masks. To answer the mask question, we have 160,000 masks, and it's been stated that we have all the PPE we need for the year. But if we have approximately 14,000 students and 2,000 staff members and a total of 160,000 masks, then that's really only 10 masks per person. And I know that that's not enough to get our students or staff through the year, because I've spent my entire career around 5-year-olds and 16-year-olds. I once had a high school student who lost his own car. I think it's safe to assume that they will lose their masks. And so I know we're going to need more than that. I know that we were supposed to get over 50,000 gloves, and we've not received any gloves. We have received face shields. We received 1,200 gallons of hand sanitizer, but no disposers, the pump that actually allows you to put the sanitizer out. So there's been some gaps, some logistical gaps in terms of having all the PPE we need, but we're trying to backfill that. And of course, much of what we're waiting on is the same thing that all schools across the country are waiting on. This is not unique to Victoria, or not even really unique to Texas. Every school district in the country ordered thousands and thousands of laptops, and so everything is delayed. We're hopeful that by mid-September we'll have most of the equipment. I think it's more realistic to think that it'll be mid-October.
We have time for one more question.
Dr. Shepard, hopefully we don't get to that point, but if we do, how will a decision be made to reclose schools if community spread reaches very high levels?
Great question. So as David Gonzales mentioned just a few minutes ago, I reached out to him last week and Dr. McNeill, of course, and asked them if we could essentially create a program, if you will, that would allow us to look at certain trigger points for not just a community, but also for the school district. And so we built this program internally that allows us to track, for instance, the percentage of hospital bed usage and the percent of community transmission based on cases. But then we're also looking at percent of students who might be out at any given time due to COVID, or staff who might be out at any given point. as it relates to COVID. So using multiple trigger points, we're looking at essentially 3 designations as a campus by campus. We're looking at minimal transmission in that everything is okay, so we can maintain where we are. At the second level, when we start to hit some of those trigger points, it becomes moderate transmission, and we're going to alert the campus that things are on the upswing, and we need to try to do what we can to stop the spread, continue to push efforts around what we know works, and then lastly, sort of a high degree of spread, and this is when the school could potentially have to be shut down. And we're looking at it by campus to start with, because, for instance, a breakout at Mission Valley, for instance, we would want to look at that site specifically rather than shut down the entire district.
Thank you for your questions, and thank you, Dr. Shepard, for your time.
Thank you.
Before we close, I want to give reiterate a couple of those main points that Dr. Shepard shared. And of course, this is available on covid.visd.net's website. 8 a.m. tomorrow morning begins virtual-only classes for elementary school-age students. 8:30 a.m. is the starting time for middle school students, and 7:30 a.m. is the lucky starting time for high school students. Again, virtual only will still be an option come September 8th, but the face-to-face option will become available as well. Registration is also requested for resources, so if you have not yet requested resources such as an iPad, hotspots, whatever it may be, please contact VISD as soon as possible so that they can get that squared away for you. The change of mode of learning, if you want to change your mode of learning, you can do so by August 25th as well. And if you have not yet heard from your campus or your teacher, you can call them, but the best way to reach them is by email. So I thank you all for listening to today's briefing. We'll continue to educate you all as we receive more information and as time allows it. But in the meantime, you can visit victoriatxoem.org. Thank you and have a great rest of your day.